Q1. Which type of joint is the shoulder joint? A. Hinge joint. B. Ball and socket joint. C. Pivot joint. D. Saddle joint. Answer: B. Ball and socket joint. Q2. Which organ is responsible for the production of insulin? A. Liver. B. Pancreas. C. Kidney. D. Spleen. Answer: B. Pancreas. Q3. The functional unit of the kidney is called A. Nephron. B. Alveolus. C. Osteon. D. Sarcomere. Answer: A. Nephron. Q4. What is the primary function of hemoglobin in red blood cells? A. Blood clotting. B. Oxygen transport. C. Immune response. D. Nerve signaling. Answer: B. Oxygen transport. Q5. Which part of the brain controls balance and coordination? A. Cerebrum. B. Cerebellum. C. Medulla oblongata. D. Hypothalamus. Answer: B. Cerebellum. Q6. Which blood vessel carries oxygenated blood from the lungs to the heart? A. Pulmonary artery. B. Pulmonary vein. C. Aorta. D. Vena cava. Answer: B. Pulmonary vein. Q7. The largest organ in the human body is A. Liver. B. Skin. C. Lungs. D. Heart. Answer: B. Skin. Q8. Which type of muscle is involuntary and striated? A. Skeletal muscle. B. Smooth muscle. C. Cardiac muscle. D. Tendon muscle. Answer: C. Cardiac muscle. Q9. What is the pH of normal blood? A. 6.8. B. 7.4. C. 7.8. D. 8.2. Answer: B. 7.4. Q10. The SA node in the heart is also known as A. AV node. B. Pacemaker. C. Bundle of His. D. Purkinje fibers. Answer: B. Pacemaker. Q11. What is the primary function of the small intestine? A. Absorption of nutrients. B. Storage of bile. C. Production of insulin. D. Filtration of blood. Answer: A. Absorption of nutrients. Q12. Which of the following is not part of the axial skeleton? A. Skull. B. Vertebral column. C. Rib cage. D. Pelvis. Answer: D. Pelvis. Q13. The process of blood cell formation is called A. Hemolysis. B. Hemostasis. C. Hematopoiesis. D. Hemoglobinopathy. Answer: C. Hematopoiesis. Q14. Which cranial nerve is responsible for vision? A. Optic nerve. B. Facial nerve. C. Vagus nerve. D. Trigeminal nerve. Answer: A. Optic nerve. Q15. Which structure prevents food from entering the trachea during swallowing? A. Epiglottis. B. Larynx. C. Pharynx. D. Esophagus. Answer: A. Epiglottis. Q16. The hormone responsible for stimulating uterine contractions during childbirth is A. Oxytocin. B. Prolactin. C. Estrogen. D. Testosterone. Answer: A. Oxytocin. Q17. The normal range of respiratory rate in an adult is A. 8 to 12 breaths/min. B. 12 to 20 breaths/min. C. 20 to 30 breaths/min. D. 30 to 40 breaths/min. Answer: B. 12 to 20 breaths/min. Q18. Which part of the neuron receives signals from other neurons? A. Axon. B. Dendrites. C. Synapse. D. Myelin sheath. Answer: B. Dendrites. Q19. The main function of platelets in blood is A. Oxygen transport. B. Blood clotting. C. Immune defense. D. Hormone production. Answer: B. Blood clotting. Q20. What is the name of the valve between the left atrium and left ventricle? A. Tricuspid valve. B. Pulmonary valve. C. Mitral valve. D. Aortic valve. Answer: C. Mitral valve. Q21. Which type of white blood cell is responsible for producing antibodies? A. Neutrophils. B. Lymphocytes. C. Monocytes. D. Eosinophils. Answer: B. Lymphocytes. Q22. What is the primary function of the large intestine? A. Digestion of proteins. B. Absorption of water. C. Breakdown of fats. D. Secretion of enzymes. Answer: B. Absorption of water. Q23. The tricuspid valve is located between which two chambers of the heart? A. Left atrium and left ventricle. B. Right atrium and right ventricle. C. Right ventricle and pulmonary artery. D. Left ventricle and aorta. Answer: B. Right atrium and right ventricle. Q24. What is the primary function of the hypothalamus? A. Coordination of movement. B. Regulation of body temperature and hormones. C. Processing visual information. D. Blood circulation. Answer: B. Regulation of body temperature and hormones. Q25. Which of the following is a structural protein found in skin, hair, and nails? A. Collagen. B. Actin. C. Keratin. D. Myosin. Answer: C. Keratin. Q26. Which vitamin is necessary for calcium absorption in the intestine? A. Vitamin A. B. Vitamin B12. C. Vitamin C. D. Vitamin D. Answer: D. Vitamin D. Q27. The process of inhalation is primarily controlled by which muscle? A. Intercostal muscles. B. Diaphragm. C. Abdominal muscles. D. Pectoral muscles. Answer: B. Diaphragm. Q28. Which structure connects muscle to bone? A. Ligament. B. Tendon. C. Cartilage. D. Synovium. Answer: B. Tendon. Q29. The process by which oxygen and carbon dioxide are exchanged in the lungs is called? A. Diffusion. B. Osmosis. C. Filtration. D. Active transport. Answer: A. Diffusion. Q30. Which part of the digestive system is responsible for bile storage? A. Liver. B. Gallbladder. C. Pancreas. D. Small intestine. Answer: B. Gallbladder. Q31. What is the name of the outermost layer of the skin? A. Dermis. B. Hypodermis. C. Epidermis. D. Subcutaneous tissue. Answer: C. Epidermis. Q32. Which hormone is secreted by the adrenal medulla? A. Cortisol. B. Aldosterone. C. Epinephrine. D. Insulin. Answer: C. Epinephrine. Q33. What is the primary function of the spleen? A. Blood filtration and immune response. B. Bile production. C. Insulin secretion. D. Nutrient absorption. Answer: A. Blood filtration and immune response. Q34. The bones of the skull are connected by which type of joint? A. Synovial joint. B. Fibrous joint. C. Cartilaginous joint. D. Hinge joint. Answer: B. Fibrous joint. Q35. The pacemaker potential of the heart is primarily due to which ion? A. Sodium Na. B. Potassium K. C. Calcium Ca superscript 2. D. Chloride Cl. Answer: C. Calcium Ca superscript 2. Q36. Which of the following structures is part of the central nervous system, CNS? A. Spinal cord. B. Brachial nerve. C. Sciatic nerve. D. Vagus nerve. Answer: A. Spinal cord. Q37. The primary function of surfactant in the lungs is to? A. Increase oxygen transport. B. Prevent alveolar collapse. C. Facilitate mucus production. D. Regulate breathing rate. Answer: B. Prevent alveolar collapse. Q38. Which of the following is not a function of the liver? A. Detoxification of drugs. B. Production of bile. C. Production of red blood cells. D. Storage of glycogen. Answer: C. Production of red blood cells. Q39. The middle layer of the heart wall is called A. Endocardium, B. Pericardium, C. Myocardium, D. Epicardium. Answer, C. Myocardium. Q40. Which part of the nephron is primarily responsible for filtration? A. Loop of Henle, B. Distal convoluted tubule, C. Glomerulus, D. Collecting duct. Answer, C. Glomerulus.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!